Hello and welcome. We are discussing today something that has been screaming from all the headlines in newspapers and from all TV channels, the swine flu pandemic that the globe is in the grips of. Now, to make some sense of a debate that seems to be careening out of control, we are talking today to Dr. Satyajit Rath, who is an immunologist and someone eminently placed to shed some scientific light into the murky waters of the debate that we are having today too. So, just to start an obvious question, how much of a public health problem do you think the present swine flu or H1N1 influenza pandemic, how much of a public health problem does it pose to India?
Quantifying public health problems is always something of a difficulty because of the obvious issue of what are we measuring it against. So, look at it this way. Seasonal flu kills in the United States, for which reasonably good numbers are available, somewhere in the order of 40,000 people a year.
Right.
Given the proportion of the American population to this number, and if you extrapolate that to India, and there is no reason really not to extrapolate it at all, there may be some error factor. That's a very substantial number of deaths from what people are calling ordinary, sporadic, seasonal flu.
So, what you are saying is that you have probably about 150,000 deaths every year due to seasonal influenza in India anyway.
If you correct it for population age and so on and so forth, it may be a little bit less, but we are certainly talking in terms of that league of numbers of deaths.
And you would say that the data that you have, because we don't have Indian data, so the data that you have in Europe and North America would more or less be the same as far as India is concerned in terms of percentage of people affected?
As I said, it would be in the same league. The mortality estimates of seasonal flu are of the order of about 0.1 to 0.3%. There are always uncertainties in this. There is so far no reason to believe from global data that this particular virus has a higher mortality than that. In fact, there are arguments that it may be somewhat lower even. Put this against the great virulent flu pandemic yardstick, which is the Spanish flu, which had, depending again on how you calculate public health and epidemic data, had mortalities that people have estimated at anything between 3 to 25%. Contrast that with the avian flu, the H5N1 of fairly recent memory, in which case certainly even by conservative estimates 2 out of 5 people infected died.
So, what we are talking about is a pandemic that's caused by a relatively low virulent virus.
I think all available evidence
That's
says
what
that
it seems to be saying. But compared to seasonal influenza, the number of people
Absolutely.
that are going to be affected is going to be much larger, isn't it?
Absolutely.
I mean, the European CDC in their report, they are projecting a number in Europe of about 60% of the population will be affected in the next few months, of whom about 30% would show symptoms, which means we are talking about 300 million people who would show symptoms in India in the next few months. You think those projections make sense?
To be honest, it's a little amusing because you really don't need a crystal ball to make those kinds of predictions. Practically every earlier epidemic flu has had those kinds of exposure numbers. Given that this one is a pandemic, it's not particularly surprising that we are going to achieve exactly those kinds of numbers, again give or take a few percent points here and there. And that's exactly where the epidemic may lead to a public health problem, not because the virus is so dangerous to individuals who contract them, which is a point that we need to make, because the bulk of our current panic is driven by this perception of individual risk. Individuals are not at risk in that sense. simply because the virus so far seems to be low virulence, with caveats that perhaps we'll talk about
Low
later.
risk means about 1 in 1,000 would be the average.
It's anything between 1 to 5 in 1,000 currently. But the fact still remains that with very, very large numbers of people not immune to this particular strain and therefore getting infected with it, the numbers of deaths in countries like India or China can still be substantial enough that concentrated over a 1 or 2 year period would pose a significant public health question that would need some sort of a public health policy response.
Now, do you think we can have a public health policy response given the state of the Indian public health system? I was making a back of the envelope calculation. If about 3 million people or 300 million people get affected, and what is being projected is probably about 2% of them would require hospitalization. So, we are still talking about something like 60 lakh people who would need to be hospitalized in the next 3 to 4 months. Now, those are the numbers that we are talking about.
Over years, at the very least. Yes.
So, and do we and contrast that with something like 972,000 hospital beds that we have all over the country for all kinds of illnesses.
So, let me ask you the question in return. What do you think, in the light of these obvious and glaring lacunae, should a policy response be with respect to government state demands to be made on the private health sector?
It's obvious that given the state of the public system, you cannot rely only on the
That's
public
inadequate.
system.
But essentially, it is absolutely necessary, I think, to think about ways in which the private health care delivery sector can be involved in this. We are always going to be deficient in being able to deal satisfactorily across all socioeconomic groups, across all geographical, cultural schism zones in the country. I'm not sure that, not simply for this, but for any even ongoing problem in public health, such as tuberculosis, such as malaria, we have adequately addressed this issue. If we have not been able to address it satisfactorily or even halfway satisfactorily for those ongoing problems, it's quite unlikely that we are going to be able to deal satisfactorily with this one.
Don't you think there is also a place for tackling this with some community level initiatives, if the public health system were to attempt that kind of an initiative, given the fact that at the end of the day, when a person reports with flu-like symptoms, the best medical advice today is still grandmother's advice, that is lots of fluid, rest and paracetamol to bring down the
Absolutely.
temperature.
Absolutely.
And that's something that actually people can be taught at the community level to pursue, and then to be able to detect those cases that need to be referred to appropriate levels.
Oh, absolutely. The bottleneck, this I think goes without saying. The real bottleneck is what you said earlier. We simply don't have the numbers of hospital beds to accommodate the numbers of cases that are likely to be referred.
So, what we are likely to expect is that this will sort of be like a storm which will pass over, because you expect in the next 2 years, because sufficiently large number of people will have developed immunity to the virus, and in between we will sort of blunder along, and a lot of lives will be lost which should not have been lost.
Depressingly, that is my guess.